Welcome. My name is Michael Perry. I'm a physician coordinator for the Ontario Medical Association Physician Health Program, and this is the session, the module on boundaries. Well, boundaries form the foundation of the medical relationship between doctor and patient, and sometimes they're said to be so complex it's like trying to describe what time is. It's almost like we know what boundaries are unless somebody asks us specifically what are boundaries in detail. They're so complex in some ways that it's hard to define them precisely. On the other hand, they're so important that we have to know in some general way especially what are appropriate boundaries and what are not appropriate boundaries. Well, there's a number of things. First of all, just to get a sense of the fact that there are boundary issues in the doctor-patient relationship, and then get a concept of some other ways of defining what that means. Other ways of looking at the meaning of that would be thinking in terms of roles, that the doctor plays a certain role and the patient plays a certain role, and also the norms of the relationship between doctor and patient. And then more simply, in a sense, the rules of conduct between doctor and patient. All of these are sort of overlapping concepts, Derek. Once we start to realize that doctors need to have flexibility in terms of their interaction with patients, they can't be, in a sense, defined to say particular things at all times. Like there can't be too many rules because then the doctor wouldn't have spontaneity. And then the relationship would become sort of awkward and unwieldy. You know, so there needs to be some spontaneity, but within that spontaneity there has to be some guidelines of conduct, and that's what are the key things in this module.